The MOMS trial, now completed about a decade ago, was the first time that we tested whether or not fetal therapy, treating a baby before birth, was better than treating a baby after birth. And what we discovered was that indeed that was true, that for spina bifida, if the mother and the fetus were eligible and they received surgery before birth, that fetus had a better outcome, had a better chance of being able to walk, and a better chance of not needing a shunt for some of the brain conditions that are associated with spina bifida. But the story doesn't end there, because even though we improved the chance that a baby would be able to walk, still the majority were not able to walk. Over 60% really had no significant improvement in that outcome. So we are constantly working at trying to make that better. And that's where stem cells comes into play. So our laboratory for the last 10 years has been researching different kinds of stem cells applied to the treatment of fetuses before birth for spina bifida to see if we can improve the chance of walking. We have recently had an extraordinary breakthrough in our laboratory work. We discovered in our large animal, in our sheep model, that if we treated fetuses before birth with just what we call the vehicle, just the material that we put stem cells in, the fetuses were unable to walk. But if we treated the animals with stem cells and the vehicle and the material that we put the stem cells in, those fetuses were able to walk completely. They were able to jump over barriers. They showed essentially no signs of paralysis. And the promise of this work is what has us excited about extending this to human trials. And it is my belief that we will be able to cure the paralysis of spina bifida in my lifetime.